Hi, I'm a certified occupational therapist assistant with a license. I work for a reputable therapy company. Um, I will not divulge the name, but it's a good company and it is nationwide. What I'm going to try to provide you with is just some basic tips to help with upper body stability, upper back stability, shoulder strengthening. I work mainly from the belly button up, and as an occupational therapist assistant, we work with the occupations of life. So we also work on dressing, toileting, things like that. Everyday care to help you be you. One of the things that as we age, we don't think about, one day our arm just doesn't come up like it used to. We can't reach the back of our head. Through some simple stretches, we can regain those abilities. Now, it's not going to happen overnight. And that's one thing that I think very much discourages people, in that they expect, well, I'll go to therapy a couple of times if I have to, and I'm going to be good in a couple of days. I'm sorry, it doesn't work like that. And when you go home with your exercise regimen, if you are seeing a therapist, do that regimen every day, because just going to your therapist 3 times a week, twice a week, it's not really going to help you out because you're not doing enough to help you. Drink coffee, kids. Now, don't do these, but I digress. Um, with these basic movements, these basic stretches, you're going to use something as simple as a broomstick. Okay? Now, whichever side is affected, right side, left side, doesn't matter. You're going to grab a hold of the end of the broom with the affected side. Straighten your arm as much as you can. Now, you don't have to reach way back with your unaffected side, but you're going to stretch up and bring it back down. Now, you're not helping with this arm. This arm is just along for the ride. Only thing you have to do is maintain that grip and keep that arm straight. And you're going to push up with the other side. You're going to feel a stretch. Push into that stretch a little bit and bring it back. Now, the first 2 to 3 are going to be difficult. You're not going to feel good. If you have a significant amount of pain, you want to stop at that pain point and maybe back off a half an inch. Because by the time you get to 10 stretches, you're going to realize that you're going past that half inch and that pain is going to get less and less. Now, another thing that we tend to forget is if we reach out to the side. Now, normally we can reach out quite a ways, like this. If we're compromised, we may only get to here. May only get to here. That's okay. You're still going to use your broom, but you're going to keep your arm to your side. You're going to use your unaffected side, and you're going to push out. You'll feel the stretch. Hold for a count of 3 to 5. Bring it back nice and slow. As you do these, you will notice that you're going a little bit farther. Now, this will not happen overnight. This takes everyday stretching to help you move more freely. Now, there's several more stretches we could cover. One of the big ones is keep your arms straight, and you're just going to act like a pendulum, okay? If you keep your arm at the end of your broom handle, push out to the side, bring it back, out to the side, bring it back. These are all good movements. Sometimes when we get out of a sling after a surgical repair or a fracture, you're going to have some stiffness. So straighten that arm out, let it hang. You can even shake it out a little bit. Make small circles. Just small circles, and as you feel it start to loosen up, those circles are going to get a little bit bigger. These are good stretches. They will help you on your road to recovery. Now, once we get past the stretching phase, we're going to start some light strengthening. Now, light strengthening usually comes with a yellow band, a 1 pound weight. Everybody's like, well, I could lift 50 pounds. Doesn't matter. You could lift 50 pounds. You could lift 20 pounds. Does not matter. You have to start light after a repair. So your little band here, this little light yellow band, doesn't look like much, doesn't feel like much. This is going to be your friend. Now, use your unaffected side as your anchor point. So wrap your hand up pretty good, get a good grip on it. Hold it in the center of your chest. Now, a lot of folks like to start down here and they do this little bit right here. Or they slap that band. Well, that slapping of the band doesn't do anything. You want to come up, only grab one side. You want to come up to where your arm is 90 degrees. Get a good hold. Now, press down till your arm is straight. Bring it back nice and slowly. You want to control these movements, and that's one thing that the yellow band does, is it helps you learn to control the movement. And as you control that movement, you're going to realize that you're getting something out of this. Now, you can press straight down like this. You can wrap your hand up to where your palm is facing up. Press down again, and you're going to feel a difference in that tricep muscle. You're going to feel a difference in how it is focused upon. Now, you can also push straight out. You're going to feel that across your chest. So push straight out and bring it back. You can also push out to the side. Now notice when you come out to the side, you're raising that shoulder up. Okay? You can do it at an angle. All of these are good for shoulder stability, starting to feel that in your chest, and working on your tricep muscle. Now, it only takes 3 days for muscle to start to atrophy. If you have been in a sling for 6 weeks, a lot of this is going to look like shredded wheat. It's just not really going to be there anymore. The one thing you can maintain is your grip strength. So if you have a foam ball, squeeze that foam ball, okay? Now, it's going to feel silly because it's just a foam ball. You'll be surprised at how much of your grip strength you can maintain by just squeezing a foam ball, okay? You can start out with a very light foam ball that you could squish between your fingers, or a harder foam ball, almost like a Nerf softball. You're going to notice a difference in that foam. One thing I like to use in my therapy sessions is a pool noodle. And it sounds silly, but you cut a hand width size of pool noodle and you squeeze that, and you will notice that it takes quite a bit to crush a pool noodle. A way to what we call grading, which is making things easier or making things harder. A way to grade that grip strength with a pool noodle is take a sliver of another pool noodle, put up the center to where now it's almost solid foam. and you will definitely notice a difference in how hard it is to squeeze. So maintain that grip strength while you're in your sling. You're out of the sling, you've done your stretches, we're working on some strengthening. So you can anchor at your hip, and you can laterally raise your shoulder. Remember, nice slow movements. You can turn your thumb to where it is facing your body, and this is where you get to play Three Musketeers and draw a sword to bring it back down. You want to try to get to 90 degrees and bring it back down. Notice all of these movements are not fast, and these are all designed to help with shoulder strengthening and stability. If you have a way or a doorknob, doorknobs are kind of tricky. You got to be careful because the band will slip off and slap you. But if you have a way to anchor your band around something, use your unaffected side to grab the bottom of the band and then internally rotate and bring it back out. Okay? Now you can make this harder by pulling and reducing slack and reducing distance traveled, and that's going to make that little yellow band a lot harder to pull. You can loosen it up. The longer that band is, the easier it's going to be to pull. If you shorten it, it's going to be harder to pull. So you can grade this yourself. That will actually work on your pectoral muscle and your anterior deltoid. Sorry, I'm tripping over dogs here. Keep your arms straight. Bring them up to 90 degrees. And the only thing you're going to do here is just pull your shoulder blades together and relax. You don't have to have a lot of resistance with this. You'll get there, but you don't have to start out with a lot of resistance. Focus on really contracting those muscles between the shoulder blades and pulling them together. It's almost like you're trying to pinch a piece of paper between your shoulder blades, and that helps with shoulder stability. Wrap your hands up again, arms down to your sides, and we're going to do a lateral raise on both sides. Now, just because this arm or this arm has been in a sling and is weaker than the one you've been using a lot, don't forget your buddy. We can work on the affected side all we want, but don't forget your buddy over here. Make sure that you try to maintain some uniformity, okay? Now, this little yellow band is not going to bother your unaffected side as much as it will your affected side. That's a given. You've been like this for 6 weeks. Work on some lateral raises. They don't have to be huge. Nice lateral raises. Again, come back up to 90 degrees when you're able to get there, and you can do larger movements and pull those shoulders back like that. Okay? Nice, slow, control your movement. Start with probably 15 inches between your hands. If you start way out here, you're going to get less out of it, but it will be easier. Easy's okay to start with, but we want to make sure that we get something out of these exercises, or you're wasting your therapist's time and you're going to be mad at your end result because you didn't gain what you thought you would. So really focus on the movement and controlling it. Okay? Now, your bicep after 6 weeks, it's just not there. It's atrophied. It doesn't look right. You want to get that back, especially guys. They're like, oh, look at my arm. Well, the one thing you can do if you have a long enough band is put it on the floor and step on it, okay? Now, remember, keep that arm straight, and you want pressure from the beginning. Now, it's not going to be a lot of pressure, but it's going to be enough. And you can pull up, back down. You can turn your palm face forward, come up, back down. You can turn your hand over, come up, back down. You can come across. All of these movements have tension on them. Now, you want tension from the beginning all the way down to the bottom. You don't want slack, because slack is not going to help you. So nice, slow movements that are going to help you regain some of what you've lost. Now, as you progress, this yellow band is going to become very simple. Now, the one thing you have to watch with these is they're good for a good TheraBand brand, and I mean the bands, not tubes. I've had this for years. These can last 2 to 3 weeks depending on the brand. This is not a good quality brand, so I get about a week out of these, a week and a half, and then they start snapping. So make sure you get a good quality band or tube, and you can use a yellow tube, then red. We go to the red once the yellow becomes easy, and we really want to start kicking things up to where you feel like you're gaining. You are now gaining ground, and you're starting to feel that load. That's where red comes in. Same movements. Once the red becomes easy, we're going to go to a green band or a green tube. Same movements. Green is going to get you pretty much back to normal. And you don't really need to go past green to be able to function every day properly. Same movements, do your stretches, go through your exercise routine, and you'll be surprised at how much you gain back of what you've lost. Remember, control, and don't worry that it's not coming back automatically. It will. You just have to be patient. Have a good day.